Dr. Aya Adel, Qasr Aini Hospital. Presentation from Laboratory Hematology Department. Please.
Good afternoon, ladies and gentlemen. I promise I'll be short this afternoon. I would like to extend my gratitude to the esteemed organizing committee as well as our professors, Dr. Azza and Dr. Aya and Dr. Iman, as well as Dr. Ahmed El-Ishtawi. Some say that diagnosis of congenital hemolytic anemias is a no-brainer. However, this statement is a bit challenging, as we can see. A lady who's 33 years old is coming for bone marrow assessment before her routine splenectomy to alleviate her dragging abdominal pain, which is a 7 years duration. Her past medical history reveals multiple attacks of jaundice, and as well as gallstones that necessitated a cholecystectomy procedure before. Her complete hemolytic profile was normal. She had one time blood transfusion, which was 5 years ago. Her clinical examination revealed the hepatosplenomegaly to be significant. Her complete blood count was normal apart from the mild normocytic normochronic anemia, while her retics count, reticulocytic count, was disproportionate to the degree of anemia. Her other laboratory investigations were normal apart from the indirect hyperbilirubinemia as well as mild elevation in ferritin level. Her marrow examination was hypercellular for her age. The lineage that caused the hypercellularity was the erythroid. The MAE ratio as a result of this hypercellularity was 0.5. Remarkably, the erythroid lineage was as well dysplastic in the form of multinuclearity and binuclearity. The red arrows are the binuclearity, while the black ones are the trinuclearity. It's the multiple photos for them. As part of the routine workup, we do iron stains. Her iron profile included the same finding. It's normal to slightly increased. Her touch print revealed the same findings. It's binuclearity as well as trinuclearity. Multiple precursor erythroids were seen as well, designated in the red arrows, while the black ones are the binuclear. Her reticulin stain was normal. No findings abnormal apart from mild or occasional erythrophagocytosis. Taking into consideration the long-standing hemolytic anemias as well as dysplasia being limited to erythroids and especially the binuclearity, Hans test was ordered and it tested positive. Although the case is a 33-year-old lady, a congenital dyserythropoietic anemia type 2 diagnosis was made. Following the guidelines, diagnosis of CDA type 2 requires the history of hereditary hemolytic anemias as well as evidence of ineffective erythropoiesis, the 10% binucleated forms, and positive hemolysis test, lysis test. As well, we can do abnormal band 3 and band 4 in the electrophoresis as well as electron microscopy. However, they are not a must for the diagnosis. We can diagnose using the first 4 only. The take-home message is unexplained long-standing hemolytic anemia can be congenital. Congenital anemias are not always a no-brainer. It's sometimes extremely difficult. Thank you.
Thank you, Dr. Aya, for your precise and nice presentation.